Good evening, everyone, and welcome to a new episode of Wellness Matters. As always, we are very eager to engage with you tonight, so make sure to post your comments and questions in the live chat on both Facebook and YouTube, and don't be shy. We encourage you also to post your questions as early as possible during the episode so that we have time to answer them. Having a baby is one of the most joyous moments in a couple's life and a dream come true for many. However, for some couples, this can become a monthly disappointment filled with heartache as attempt after attempt fails. Infertility affects 10 to 15% of couples worldwide. That's 50 million couples. Another problem, which is distinct, however equally emotionally stressful, is miscarriage that affects around 15 to 20% of known pregnancies. Tonight, we are going to delve deep into these topics, their causes and possible treatments with Dr. Tamara Aladhami, who is the Chief of Obstetrics and Gynecology at the American Hospital with over 15 years of experience. She graduated from Al-Mustansiriya University in Baghdad and completed her specialty in obstetrics and gynecology as well as her advanced training in the UK. She also has a diploma in sexual and reproductive health from the Royal College of Obstetricians and Gynecologists, of which she is a member. Dr. Aladhami also worked as a consultant obstetrician and gynecologist at Inurin Bivan University Health Board hospitals in Wales before moving to Dubai. Dr. Aladhami, thank you so much for being with us tonight.
Thank you very much for inviting me. I'm very glad to be here to talk about this interesting topic.
It really is an interesting topic, and we've noticed lately that the prevalence of infertility has increased. However, is it really an increase in infertility, or is it simply that couples are getting married and conceiving later in life, or that it is okay now to talk and discuss this subject?
Subfertility over the last few decades is increasing due to many factors. Some of them are social, others are medical. The reality is we don't know all the reason for that increase, but what we know is age, some environmental factors, and lifestyle has negative impact on the fertility. Women these days are getting married later and having their family at later age, and we know for many reasons. Some of them they pursue higher education, or they have other commitments with their careers, or they haven't found the right partner. And we know for facts that by the age of 35, the quality and the quantity of the eggs decline significantly, and the fertility decline significantly. There are other factors, lifestyle, smoking, stress, increased obesity. All this has a negative impact on the chance to conceive naturally. Some of the medical condition is increasing as well, like diabetes, because of the increased obesity. Other conditions like fibroids and endometriosis might also increase in later life. And don't forget as well, male fertility. There are lots of evidence show that male fertility also decline in older men.
Now we're going to discuss some of these topics later on in today's episode, but before we delve into the details, what about the pill? I mean, so many people say if a girl is on the pill, this might affect her fertility in the future, taking into consideration also that a lot of girls start the pill at a younger age due to skin problems, acne, or hormonal problems. So is this myth or fact?
Contraceptive pills or hormonal pills or any type of contraception, regardless to its type or duration, has no long-term impact on the fertility whatsoever. The minute we terminate the contraception, fertility will be resumed later. Maybe it takes 1 month or 2 months, or sometimes immediately. There are some types of contraception, like the injections, can delay slightly the ovulation by maximum 1 year, but has no long-term impact on the fertility whatsoever.
Now, a lot of women are also, as we mentioned, marrying later on, conceiving later on in life. So a question that's on the mind of so many women is, should they freeze their eggs if they are waiting to get married, and at what age is it ideal to do that?
Egg freezing is a method of fertility preserving for the future pregnancy. So if the woman is not ready to have her children for many reasons, some of them are medical. She could be going through treatment of cancer, for example, and having radiotherapy, chemotherapy, or she hasn't found the right partner, or maybe because she's at high risk to develop some problems like premature ovarian failure in the family, then definitely freezing eggs is one of the options. But keep in mind that this method doesn't guarantee a baby. As we said previously, that by the age of 35, the quality and the quantity of the eggs in the ovary decline. So if the woman considering this option, she should really consider it before that age. Many centers, they decline any request for freezing eggs if they are 40 and above, because the success rate is very, very limited. The freezing an egg, it's not an easy process. The woman is going to be subjected to many hormones to stimulate the ovaries. Then the eggs will be collected by a small procedure under sedation, and then it can be frozen between 5 to 10 years. In exceptional circumstances, a bit longer, until she's ready to have the children. Then the eggs will be thawed and put back after fertilizing them into the uterus. Now, does that guarantee a success? No. Unfortunately, no, but it's definitely an option.
Is there a relation between the duration of freezing the eggs and the success rate? Like if you freeze them for 10 years, your success rate goes down with every year of freezing, or it's not related?
Because of it's only a recent advances. The data and the research about it is very limited. At the moment, it's not advised to freeze the eggs more than between 5 to 10 years. The data is very, as I said, is very limited. But there are some conditions when we, for example, if the young girls have to subjected to chemotherapy or radiotherapy because of childhood cancer at the age of maybe 17, 18, they can have the option to freeze them for a longer time. But again, the outcome is very vague.
Okay. Now, going into more detail into some of the infertility causes. Obviously, we have to mention here that as per the Mayo Clinic, the rate of fertility is not only due to women, as you mentioned, doctor. So a third of infertility cases is due to women, a third is due to male factors, and a third is sometimes either a bit of both or unexplained. But today we're going to focus on the female factor of infertility. So what are the most common causes of infertility for women that you see?
You are right about the male factor and female factor. To be more specific, is about 38% of the infertility are caused by problems with the women, about 25% due to male factor or problems with the partner, the husband, and there is 15% is the difficult one, which is unexplained, when we find everything is normal with both of them. And there are a combination of both. They both have the problems, which is about, again, 25%. In female, one of the common causes is hormonal imbalance. And that can be either problems with the pituitary glands, which is a gland in the brain, problem with the prolactin hormones, which related to a tumor in the brain, release excess amount of prolactin affecting ovulation. Or there is a condition called, a very common condition, Polycystic ovarian syndrome, which again affects the hormones, the female hormones, and prevent ovulation. There are the thyroid problems, which can affect the menstrual cycle. We have also problems with the structure of sometimes the structure of the uterus and the tubes.
And maybe we can have the picture here for the reproductive system of the women, so that we can have a look at how the female reproductive system is. But go ahead, doctor, continue, and you'll see the image as it appears.
So sometimes there is an abnormally shaped uterus. Some women born with this shape, like what we call it bicornuate or a horned uterus, can affect implantation. There are some tumors like fibroids which can also affect fertility. And sometimes there is a problem with the tubes or problems called endometriosis, which can cause blockage in the tubes. Problems in the cervix, which can cause difficulty in conceiving, especially if she has previously multiple surgeries, for example, cone biopsies, which can cause stenosis of the cervix.
Okay, so I think this is the picture we were looking for, which shows the uterus and the ovaries.
Ovaries, yes, yeah. So all the parts can have different problems, which we can tackle, and it will make our job easier if we identify it earlier.
Now, some of the hormonal problems might be a bit easier to treat than other things. So let's start with that. Whether it's the pituitary gland, we're going to touch upon polycystic ovaries in a bit. So let's focus about the simpler hormonal imbalances that might cause infertility.
Well,
treatment
of, like, for example, prolactin, if it's high, there are some medication to lower prolactins. And with the help and compliance with the patients, it's easy to treat, and it's easy to achieve a normal level after a few months of the treatment. There are other, like the thyroid, for example, underactive thyroid or overactive thyroid. Again, it can be easily treated, and there is no permanent effect on the fertility. Polycystic ovary, just weight reduction can improve the hormones and improve ovulation without need for another hormonal addition.
Now let's explain polycystic ovaries because the polycystic ovarian syndrome is quite common to a certain extent. I mean, maybe 10 to 15% of women have polycystic ovaries, but does it necessarily mean you're an overweight woman if you have polycystic ovaries? And to what extent is it difficult to get pregnant? And I think we also have an image for polycystic ovaries showing the difference between a normal ovary. If you can explain on it when we see it. But
well, polycystic ovary is becoming very common, even in younger girls. It's a condition where the male hormones in the body of the woman is higher than it should be. And also, if there is the sensitivity, also problem with the sensitivity of insulin to the insulin receptors, collectively that will affect the ovaries to produce mature eggs. So the ovaries will look like having multiple cysts.
Can we see the image again, please, so that we can explain on the image? So it has multiple cysts. If we can compare
multiple
the two
cysts,
images.
which called follicles. These multiple cysts has immature eggs, and because of the excess androgen or excess male hormone, they fail to mature and fail to ovulate. Although, of course, there is other symptoms like excessive facial hair, obesity, and acne, which come along with these complications and hormonal imbalance.
So what is treatment for polycystic ovaries?
Treatment depends on what's the main concern for the patient when they come. But for every woman or young girl coming with the polycystic ovary, the first advice is to achieve a healthy weight because most of them are overweight. Yes, sometimes they come with normal weight, but majority they have a problem with the weight. And losing just about 10% of this extra weight can improve ovulation and the hormones without the need for any additional hormonal treatments. So exercise and healthy diet and weight loss is the key. Then it depends. If the woman coming with fertility problem, then we can give additional hormonal treatment to stimulate the ovaries to produce eggs. Also, there are some medication to improve insulin sensitivity, like the metformin. This also, there are good evidence that it can also improve ovulation. There are some supplement, vitamin-like, which is recently been found also can improve insulin sensitivity, Insitol they call. And I tend to give it to younger girls to prevent the need for hormonal treatment. Contraceptive pills, if they are having irregular cycle, they improve their cycle, and they improve the level of androgen, which is the male hormone as well.
And usually those women are able to get pregnant after some simple treatments?
Usually, yes, yeah. There are the odd cases which is difficult, but most of them, they are easy to treat.
Okay, great. Now another problem, which is probably more complicated, is endometriosis. Can you start by explaining what endometriosis is?
Endometriosis is the condition where there is a tissue which is supposed to be just sitting in the lining of the uterus. It implants itself outside the uterus. And by implanting itself outside the uterus, it will create inflammatory reaction and scarring. And that would cause pain, severe pain during menstruation, sometimes a chronic pain even without the menstruation, cyclical bowel symptoms, cyclical bladder symptoms. Sometimes would be bloods in the urine or in the bowel motions. And sometimes they present with infertility. But there are good numbers of women without any symptoms at all.
So can you explain what we were seeing on the image, doctor, when it comes to endometriosis?
So these are the black dots are the endometriosis lesions, which is between the bowel and the vaginal wall. These are considered as a deep endometriosis. For those type of endometriosis, we need more advanced MRI to diagnose them.
Okay. Now, a lot of this endometriosis also can affect the fallopian tubes and thus fertility for women.
Yes, that's absolutely right. It can either cause a blockage in the tube or even without a blockage, just it creates some sort of inflammation within the female reproductive system, which make implantation difficult.
Okay, so let's talk about diagnosis. So how do you assess the severity of endometriosis and how do you diagnose it?
When a woman comes and with a symptom suggesting endometriosis, first we try with a simple test like the ultrasound. Ultrasound is good in identifying the what we call chocolate cyst. Chocolate cyst is actually a name for the endometriosis cyst, which cyst on the ovaries. But ultrasound not good to diagnose deeper endometriosis, and MRI would be the ideal method to diagnose deep endometriosis of the bladder or of the uterus. But the gold standard to diagnose endometriosis is actually laparoscopy, which is a keyhole surgery. We can directly see where the endometriosis is, and we can treat it as well by removing it, excising it. Although it's not a curable, but it can improve the quality of life, it can improve pain, and it can improve fertility.
Now let's explain laparoscopy. We actually have a picture as well, if we can see it, so that the doctor can explain the procedure in diagnosing it. Not this picture, if we can go to the picture of laparoscopy. And just start by explaining, doctor.
So laparoscopy is considered one of the minimal access surgery. We usually put a scope in the belly button or in the umbilicus, and we will be able to see all the pelvic organ. It's the advantage of having a laparoscopic surgery. It's the women can recover very quickly. They can go back to work within a few days, and the scars from cosmetic point of view is very, very small.
Okay. Now let's move on to talk a little bit about miscarriage. Miscarriage obviously is also a very heartbreaking experience to go through. So what are the main causes of miscarriage? And we have a question on Facebook. How long after a miscarriage can a woman try to get pregnant again?
Miscarriage is a very devastating event for the couple. 70 to 80% of the miscarriages, especially those which happen in the first 3 months, are due to chromosomal abnormalities. The good thing is it rarely can be recurrent, so only 1% of the couple experience recurrent miscarriages. And to answer the questions, usually we advise after 2 to 3 normal cycle, a woman or the couple can try for another pregnancy. Talking about the reason for the miscarriages, it depends. As I said, first 3 months, most of the common causes is chromosomal abnormalities. Chromosomes are the genetic material which comes from the father and the mother. That doesn't mean that they have abnormal chromosomes, but during the process, mixing these chromosomes, something happens wrong, which led to abnormal chromosomes, and of course it will stop the embryo from developing. There are other causes like infection, cytomegalovirus, rubella, HIV, very high temperature. All this can lead to miscarriage. There is a group of miscarriage which happens later after the first 3 months. Most of them are either due to infection or cervical weakness, or what we call cervical incontinence, which usually happen between 16 to 18 weeks, either because of previously the lady had previous surgeries which make the cervix very weak, or she born with a very weak cervix.
And what's the
good
solution
news
here for
is
the cervix?
the next, usually if they come with sudden dilatation, we do emergency cerclage, we call it, which is putting a suture to try to close the cervix. Or in the future, if the miscarriage happens in the future, we recommend to have the suture earlier at 12 weeks gestation.
Some of the causes of miscarriage, as you mentioned, are chromosomal abnormalities, one of which is anencephaly, which is extremely devastating. Usually it ends in miscarriage, even though sometimes the woman can carry the baby to term, but that would be even more heartbreaking. But for miscarriages, when anencephaly is the case, what happens?
Anencephaly is a condition where there is absence part of the skulls, which is the bone of the head, and the part of the brain, and it's not compatible with life. Majority of the babies die early in pregnancy. Some they have stillbirth, so in the second part or third part of the pregnancy they die, and very few make it to full term, and if they born they live for a few hours and die. Unfortunately, we can't specify which gene caused the anencephaly. But we know that lack of, for example, lack of folic acid contributes to the problems which called neural tube defects. One of the preventative methods, usually we ask a woman if she had previously anencephaly to take higher dose of folic acid, the 5 milligram. Also, we found a link between obesity and this condition, and always for any miscarriage, regardless to the cause, we advise achieving a healthy weight before trying to conceive again, be on folic acid before trying to conceive, and try to avoid any medication, unnecessary medication, and stop smoking.
If a woman has this case, what are the chances it will happen again?
There is a slight increased chance. This is why we put the woman on folic acid and very close surveillance. But overall, yes, there is a slight, but overall it's rare to happen again.
Okay, and is it actually, can the woman do anything to prevent it other than take folic acid?
Unfortunately, there is nothing else other than taking the folic acid. But in my entire career, I haven't seen a woman who had two problems, two anencephaly miscarriages.
Now, in addition to this, what other abnormalities are common in the first trimester that usually lead to a miscarriage? Down syndrome?
Down syndrome can lead to miscarriage, but there are so many babies born with Down syndrome and they are absolutely fine. The most common chromosomal abnormalities is trisomy 16. Actually, the pregnancy never survives 10 to 11 weeks. Always end up in miscarriage. There are other trisomy. Trisomy means there is an extra chromosome which affect the development of the fetus. There are others like the trisomy 21, which is the Down, or trisomy 22. All these chromosomal abnormality contributing to about 70% of all miscarriages.
Now, when a woman has a miscarriage or recurrent miscarriages, because a lot of women who actually have one miscarriage end up having 2 and sometimes 3 miscarriages, when do you start testing? And what are the tests that a woman should go through to check what's wrong or if there's anything wrong?
Actually, Maya, it's not a common problem. So only 1% of women they have recurrent miscarriages. So the good news, if a woman experiences a miscarriage, it's very rarely she will have a second one. Usually, if a woman comes with the first-time miscarriage, we do simple tests, checking thyroid, checking the diabetes. We don't do extensive test for the first-time miscarriage. But if that happens again, Then we go into try to dig deeper into the investigation and try to find out whether she has conditions like antiphospholipid syndrome, chromosomal abnormalities. We can test both partners for any genetic problems.
Now, a lot of the miscarriages, which are simple to treat, are also due to a blood clot during the formation, and usually the treatment is simply with aspirin. How common is that?
Aspirin and there is another medication called heparin or clexane. Also, it's not that common, but there are good evidence that if there is a recurrent miscarriage and there is a condition like affecting the clotting factors, then giving the aspirin and clexane can improve the chance of having a successful pregnancy in the future.
Any other treatments that are common for miscarriage, or what are the most common causes, if we just want to highlight the top 2 or 3 causes of miscarriage that you see?
Obesity and smoking. So basically lifestyle. If you lead a healthy lifestyle, you can prevent lots of problems which comes with the obesity, like diabetes, like polycystic ovary, and smoking. Smoking can not just cause miscarriage, it can cause stillbirth as well, which is sudden death in the 3rd trimester, which is very, very devastating.
Dr. Aladhami, thank you so much. It was really a pleasure discussing this topic with you tonight. I wish we had more time to go into more details, but hopefully in another episode.
Thank you very much.
Thank you. With this, we come to the end of this episode. Unfortunately, miscarriage and infertility are both very emotional problems, although distinct problems. If you are struggling with either, stay hopeful. With today's science, there's bound to be light at the end of the tunnel. Before you go, don't forget to like and share this episode on Facebook and to subscribe to the American Hospital's YouTube channel. Join us next Tuesday at 8:30 p.m. as we go into the world of nutrition and discuss fat diets, diet pills, and the best course of action to lose weight with clinical dietitian Aya Sarhal. I hope you come prepared with your questions, and have a good night.